Of the lockdown, Sadag surveyed 1,214 South Africans about their state of mental health. About 12% of them said they were feeling suicidal. Now let's discuss this further when I'm joined via Skype by Clinical Psychologist Nozi Nyawose. Ma'am, thank you so much for joining us here on SABC News. We appreciate your time.
Thank you for having me.
Let's talk about the psychological impact that the pandemic is having on people. I mean, we can sometimes underplay the role that, losing loved ones or even just being isolated and having to stay away from people can have on people's mental health. Perhaps you can talk to us and really the processes that people are sort of going through to deal with grief.
Well, Flo, I think the processes vary and they range from individual to individual. I think what we definitely do confirm about ourselves as people is that we are social creatures, and I think COVID-19 and lockdown has been quite detrimental to a lot of individuals. I think sadly a large number of the population do not have equitable resources for mental health. And COVID, as you said, it's left many people grieving, it's left people childless and parentless and traumatized and obviously disillusioned about the future. And being disillusioned about the future is the very same thing that causes a lot of anxiety in people. It's causing a lot of psychological symptoms, and people fail to have coping mechanisms to cope with daily activities. And that's why we start to see a large rate of suicide, a large rate of exacerbation of mental health conditions. And I think even the number that you just gave, the 1,214, are the reported cases of people who are suffering. There's a lot of people with mental health conditions who are not seeking assistance, who are not reporting and not recognized.
The fact that those surveyed by Sadag, 12% of them said that they felt suicidal. Of course, if they were to have surveyed an even larger number than that, we would have perhaps even gotten an even scarier outlook as to what the situation is in the country at the moment with regards to how people are feeling in terms of thinking and contemplating suicide. What are your thoughts on this? What are your thoughts on the fact that people are really believing that it may just be better to just sort of end one's life? And I wonder, what do we do in a situation like this?
I mean, it definitely tells us the magnitude of the difficulties people are facing. I mean, it takes a lot for a person to decide that it's enough. I want to end my life. I want to take my life. With suicide, it becomes gradual because people would first start with having suicidal intent, where they just have ideas of suicide due to different difficulties that they may be going through. And they start to plan their suicide. They start to plan everything that they want to do and the different avenues that they can take. And this eventually leads to intent, from ideation to intent. And it just tells us that people are suffering, people do not have assistance, and people do not seek assistance. And there's also quite a lot of stigma that's also associated with mental health condition, because people are still stigmatized, people are still ostracized when it comes to those conditions. But it tells us that a large number of the population of people are suffering and they need resources to deal with mental health conditions.
And is there sufficient help out there? I mean, sure, if you can afford it and you've got the cover for it, one can obviously go and see a psychologist like yourself and pay for it. But that's not the reality for very many of the people in our country, in our societies. The fact of even going to seek help is a cost that some can't even actually afford. What kind of help is out there, and is it even sufficient?
Well, the sad reality, unfortunately, is that it's very expensive to see a psychologist. It's expensive to see a psychiatrist, and many of them require you to have medical aid, which obviously, because of the economy of South Africa, many people cannot afford to have medical aid. Many people are still even struggling to put food on their table. So medical aid is quite a luxury that not everyone can afford. But fortunately, I think government has done a lot when it comes to our public healthcare sectors. because majority of the populations in South Africa and of the hospitals in South Africa now are equipped with psychiatric facilities and mental health resources. They may not be sufficient, which is a fact, but they are available. I think one of the negative factors is that people have to wait quite a long waiting list in order to be seen by a psychologist, and unfortunately at that time it may be too late. But in many hospitals in South Africa we have psychiatric and psychological facilities where they are inpatients and outpatients that are kept in the hospital, and also day-to-day patients that can consult and go home.
Yeah, I mean, there's different triggers, that people have, and I really want to know, in your experience, especially during this time of the pandemic, what has really been the biggest issue that people have come to you and sort of needed help with? I'm wondering if it's grief, because of the fact, as you said earlier on, that people have lost children, have lost parents, have lost all sorts, and I wonder what is the biggest trigger that you're finding that you're having to sort of consult on?
I think one of the biggest triggers is that people have lost the ability to control their surroundings and everything around them. And this builds a lot of anxiety. People are not able to come to terms with the fact that they are fighting the unknown. They don't know, they are disillusioned about what the future holds, especially when it comes to COVID, when it comes to employment, when it comes to their own personalities. And I think a lot of people that we've seen lately have been people with exacerbated mental health conditions as a result of COVID. People not having coping skills and mechanisms, people not having support from family members, at the community at large. I think, again, as social creatures, we want to be validated, we want to be affirmed by our surroundings, by our families. And we found that a lot of people have lost their parents, a lot of people have lost siblings, the kids, they are grieving. And it's not just a one-off loss, it's a recurrent, numerous loss. We are losing everyone at this point.
And then how has life changed for you as, as providers, of mental health services? I mean, people like yourselves, how have things sort of significantly changed for you, and in how you do your work? I mean, obviously for everybody in every industry, there's been a lot of stress, added stress to the fact that we're in a pandemic. I mean, I just wonder for people like you who are really at the forefront and seeing the real sort of impacts in real time of what this pandemic is doing to people, especially when it comes to their mental health. What can you tell us about how it has affected the way in which you work and how you do your work?
I think as a mental health practitioner, patients, when they come to us, they expect that we become containers and we become vessels for them to upload all of their anxieties and their concerns and troubles. And I think obviously because we're all humans, it can take quite a toll on us as well. Yeah. I mean, having to witness numerous and recurrent loss, having to work long hours, and obviously personal factors in exposure, especially for people who work in public healthcare sectors where there's very little or no PPE at all. So it's contributed a great deal, but I think as a healthcare practitioner, this is what we pledge for when we say we want to work for the people, for the community. And I think the most important thing, not only for myself, but for other mental health care providers as well, is that we learn to fill our cup and we learn to light our candles so that it's easier to light the candles of others.
Yeah. All right, Nozi, thank you so much for speaking to us here on SABC News. We certainly do appreciate your work and your time. Thank you.
Thank you.
All right, that's Nozi Nyawose, who is a clinical psychologist, speaking to us really about the impact of the pandemic on mental health issues. All right.